topic that I will be discussing with you not only can affect each and every one of you, it can also infect each and every one of you. It's called methicillin-resistant Staphylococcus aureus. Shortened, it's called MRSA. MRSA basically is a bacteria that lays dormant on everyone's skin. The only way it causes infection if it's allowed into your bloodstream, whether it's through a cut, a scrape that you've scratched open, a bite, some kind of injury, or through your ears, nose, or mouth. It's a form of staph infection, but it's a little bit more in-depth than a staph. It's more dangerous, it can be life-threatening, and it's something that people really don't take as seriously as they should. Years ago, it was thought that MRSA was only caught by people that were hospitalized or ill. Now it is also community acquired. Healthy people that have no signs or symptoms of it can catch it just as easily. In fact, 20 to 30% of healthy people with no signs or symptoms do catch it and are carrying the staph infection, which means basically they might not know they have it and they might have a scrape that they don't have covered. If they touch that scrape and touch you and you touch your nose or your mouth or a scrape that you have, you can catch it just like that. That was the 20 to 30% fact is out of the Encyclopedia of Infectious Disease. MRSA is a type of staph infection that is called a superbug. A superbug is a microorganism that's resistant to multiple antibiotics. So a basic penicillin or amoxicillin is not going to touch this infection. Two common types are CA MRSA, which is community acquired, which you or I could catch, any healthy individual that has no signs or symptoms. Another type is HA MRSA, which is the hospital acquired, which are usually caught by patients that have catheters, IV lines, or any other medical devices implemented into their skin. What the problem mostly is, often when you get it, it looks like a spider bite. People go to the doctors think it's a spider bite, they give you amoxicillin, penicillin, and in a couple days it's not getting better. What you need to do is you need to be aware of this. If you do get any kind of wound and you go see a doctor, the best way is to make sure the size does not spread and does not get any bigger. If it does, you're in trouble. It's going to swell, it's going to be tender. From experience, I would know. Knowing the causes, how to prevent something like this, and how to treat this kind of infection is something that the public really needs to be well aware of, specifically because it is so easy to catch. There are many different causes, and it's so easy because it's direct skin-to-skin contact. Basically, sharing any kind of personal items, razors, towels, clothing, etc. Even, like I said, touching a surface that is contaminated can leave you prone to catching this infection. People that are particularly at risk are people that are in contact with somebody who has this MRSA infection, who have already had it previously, or who have taken antibiotics in the last month. As you guys may know, taking antibiotics drops your immune system, which leaves your body defenseless and can't help fight against non-healthy bacteria. Now that you do have an understanding of some of the things that can cause you to contract this infection, I would like to inform you on how to prevent this kind of thing from happening in the first place. Most importantly, it's hygiene, washing your hands. You're supposed to wash your hands at least 20 seconds each time, which seems like a lot if you really count it out while you're washing your hands, but that's how to do it the best way. Do not attempt to ever squeeze or drain any kind of sore that you might have. Make sure that you keep it covered and clean until the entire thing is healed, whether it's MRSA or not. Any kind of scratch, scrape, anything, bite you've picked open, anything. And of course, avoid all contact with anybody else's bandages or wounds. Again, refrain from sharing any kind of personal items like athletic equipment, sheets, sleeping in the same bed with someone. That can all transfer to you. If you are in a household with somebody with MRSA, it's very important that you launder your clothes in hot water. Most things you want to be careful and you use some cold cycles. You want to use hot cycles with soap and bleach if possible and dry it on the hottest setting you can. Ointments and cleansers also can be used to help prevent. This is Hibiclens, which is basically a skin cleanser. If you shave go ahead and wash your skin with this HIPAA cleanse. It basically puts like a barrier on your skin. Also with this ointment, it's a triple antibiotic ointment. It's not like Neosporin, it's way more powerful and kills off MRSA cells. Dual blade razors. From experience, dual blade, you don't want to use any more than 2 blades. Any more than 2 blades on a razor, each blade after that takes a layer of your skin off, which leaves that whole layer of skin, guys, your face, girls, your legs, armpits, open for any kind of infection. Putting lotions on and cleaning with cleansers like this will help prevent any type of unhealthy bacteria from getting into your body. Also, vitamins, taking vitamins, keeping your immune system up, all ways to prevent. Now that you have some ideas of how to prevent and the causes, the most important is to know how to treat it if the unfortunate does happen. MRSA went from resisting 5% of antibiotics in 1982 to resisting more than 25% just 10 years later in 1992. Bactrim and Septra are 2 most common antibiotics that you will get prescribed if you do happen to get this. And it's always important to finish the prescription that you have so that you can prevent any kind of reoccurrence, because you are more susceptible to get it for a second time. Worst case scenario is they will drain your wound if you get it and it's really bad. That's the worst case scenario. You'll have to have drainage. The doctor will do that all. Basically, it's no wonder MRSA is a spreading epidemic. Most people are uninformed of what this is and how it's caused. Learning and knowing how to prevent such an infection is important to keep not only you, but the ones you love safe. Getting MRSA correctly treated can be a life or death situation. Bad things do happen to good people, especially with this infection. Better to be safe than sorry. This infectious bacterium that lives on the skin of most mammals is forever spreading, but if we are knowledgeable in this matter, we can help keep methicillin-resistant Staphylococcus under wraps.